Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Head teachers and principals in Edo State commence training on COVID-19 protocols ahead of Monday's school resumption. Ekiti State COVID-19 Task Force asks residents to take responsibility in checking spread of COVID-19, condemns lapses in compliance levels. And head of Africa Centers for Disease Control commends African states for managing to curb the spread of COVID-19, describes as false suggestions that cases and deaths on the continent are underreported. Welcome everyone to the program. We begin here at the Channels Television COVID-19 monitoring dashboard. The figures you can see are the coronavirus figures in Nigeria from the first outbreak to the last 24 hours, all updated. You can see that our confirmed cases are now 57,275. The NCDC announced 176 new confirmed cases, which was reported last night across 13 states and the Federal Capital Territory. Now, of those states, Lagos recorded the highest with 73, followed by Plateau State, which is 50. The FCT recorded 17, and all of those numbers came in, and we have that total there. As at today, 48,320 people have recovered. They've all been discharged, and our death toll is at 1,095. The message is still to take responsibility because you might come into contact with someone that has the virus. But these are case representations of the virus in the 36 states of the Federation and, of course, the Federal Capital Territory. Now, let's take you over to Edo State, where there are plans to reopen the primary and secondary schools on Monday, the 28th of September. The state government, following the directive of the federal government with its support, commenced training of head teachers and principals in public schools on COVID-19 protocols, as well as measures that would aid them in ensuring the protocols are followed strictly upon resumption. The state government has also said that it has provided face masks for all teachers in the state and would ensure the provision of water and soap for hand washing in schools. In the meantime, in Enugu State, all primary and secondary schools are to reopen for third-term academic activities Monday, the 28th of September. The announcement was made after the state's education stakeholders meeting. According to the government, necessary measures have also been put in place for safe reopening, with teachers and pupils asked to abide by the approved guidelines on COVID-19, while noting that strong monitoring teams at state and local government areas have been constituted to monitor compliance. The state government says that primary 6 and junior secondary 3 students have completed their exams and are not expected to be back at school. Well, with states ramping up efforts to meet the testing targets, over 3,000 COVID-19 tests have been carried out in Nassarawa State, most of which were taken to the NCDC's laboratory in Abuja. But now the state has started testing, and there are plans to scale up capacity in the coming days to halt community spread. Our correspondent Halima Gam also reports that government is considering home care for those who meet the requirements.
As the Nassarawa State government sets to increase its testing capacity, the target is to get to the locals to minimize community spread of the virus.
The state government is acquiring a mobile testing machine. It's a vehicle that will be going around to do mobile testing. And once that comes, we hope that we'll be able to do a lot more random testing to see that our state is completely, will cover the state and we're in control of whatever is happening within the state.
Not oblivious of the fact that once testing is increased, there would be more discoveries. It is already considering other forms of isolation and treatment.
We have improved from isolating them in isolation centers to now even home care. Once we diagnose a patient as positive, we look at their homes and see if they can manage at home. And so far, we've done quite a number of cases that we've been managing at home, and they've been quite positive. The results have been quite positive. So for a person who tests positive, is more comfortable in his own environment than another environment. Even though we try to make our isolation centers as comfortable as possible, because if you go to check the isolation centers we have and treatment centers we have here in Lafayette, all the rooms are air conditioned, and there are television sets there with satellite TVs and stuff like that.
Confirmed cases of the coronavirus in the state is standing below 500 despite its proximity to the Federal Capital Territory, Abuja, which has over 5,000 confirmed cases. The government say it is not relenting in fighting the pandemic. Halima Gayam for COVID-19 update.
It's the next phase of campaign against COVID-19 as Nassarawa State Governor Darius Ishaku says his administration will continuously expand testing and treatment facilities. He was speaking when the State Technical Committee on COVID-19 presented its interim report of activities since the first outbreak of the disease in the state. According to him, the state has no active case of COVID-19 as well as no fatality recorded, of which he attributes to early detection and adequate preparations made by his administration.
I complained bitterly that Lagos is not the only state in Nigeria, neither is it the only capital, and that Abuja is also not capital only. And there are some capitals like Jalingo for Taraba State. I see no reason why we will have testing centers dotted all over and there is none in Taraba State. I'm very happy and delighted that the DG NCDC took up that challenge virtually immediately and helped by sending the consultant specialist to us here.
On the occasion of the 75th UN General Assembly holding virtually, Nigeria's president has asked the United Nations to ensure accelerated development, manufacturing and uninhibited supply of safe and effective coronavirus vaccines to all parts of the world. In his address, President Muhammadu Buhari pledged that Nigeria will partner with the UN and some other countries to achieve the target on COVID-19 vaccine.
The international community will need to cooperate in addressing the scourge of poverty, particularly in developing countries. It is in this regard that we commend the President of the 74th General Assembly for launching an alliance for poverty eradication in June. We encourage global leaders, particularly leaders from the global North, to support the alliance at this time when the coronavirus pandemic is reversing gains made in the achievement of the 2030 Sustainable Development Goals and pushing an additional 500 million people into extreme poverty.
Now, with COVID-19 vaccines currently in the final phase of study, many wonder when the vaccine will be declared safe and effective. Joining us from Abuja studios is a pharmacist, clinical pharmacist, Peter Anna-Marie, head of pharmacy department at Socorro District Hospital, FCTA. He's also the deputy director of pharmaceutical services. Thank you for joining us on the program. You've heard Nigeria's president advocating for full supply of safe and effective COVID-19 vaccines to all parts of the world. How soon will we know, based on the status of the phase 3 trials currently underway, that it will be safe?
Thank you very much for having me. The World Health Organization has told us that the earliest we should expect the COVID-19 vaccine in the market or be released for treatment to use for vaccinating people will be mid-2021. Now we have the information that about 40 vaccines are undergoing the phase 3 trials. Now, you know, it is expensive to produce the vaccine, and every of the phases involved has to be followed through and through so that we do not release into the market, no matter how much we're in a haste, the things that will cause harm to the people. Because by the time the vaccine is licensed for use, it is going to be used on healthy population. So we are careful not to release in a haste vaccines that have not undergone all the processes, all the phases of trials into the market. So for the earliest time that the WHO, World Health Organization, has assured us that a vaccine will be released into the market will be mid-2021.
All right, so I guess those expecting it before November are cautiously optimistic. But the WHO also announced that countries representing close to 2/3 of the world's population joined its plan to buy and fairly distribute the COVID-19 vaccines around the globe. So we're looking at 64% of the world's population signing up. But we also have the perhaps unequal power dynamics in global health and then vaccine manufacturing capabilities. Doesn't this pose a challenge to equitable access to vaccines?
Yes, it actually poses a challenge to equitable vaccine distribution or access to vaccine in the entire world. But now, there is a conglomerate, an association of about 172 countries and economies that have come together to plan, to develop, to release into the market as soon as possible a vaccine that will be equitably distributed around the world, a vaccine that will be safe and efficacious for human use. So if the best thing to do now is for all countries to join hands with them, because the conglomerate needs money and they need funds to be able to achieve the aims of developing or bringing a COVID vaccine that will be effective to the world.
Are you surprised that China and the US, in our last check, are absent from WHO's list of partners in the COVAX, the COVID-19 Vaccines Global Access Facility?
Yes, everyone in the world should be surprised because we know the part those two nations can play in the availability or the time which their influence on availability of the vaccine in the market as soon as possible. Because for one, the disease actually started in China. So we know that they may have some information on the disease that other people do not have. So their influence on that platform will be very much welcome. So if they are not there, it is not good for that organization. And the US, based on their economic powers, based on their influence on the health, on the global health of the whole world, will know that their presence is highly desired in that place. So everyone should be surprised why they are not there.
We'll see how things play out in the coming days. We'd like to thank you so much, Mr. Peter Enamarie, Head of Pharmacy Department at Socorro District Hospital at FCTA. Thank you for joining us on the program.
Thank you very much.
Now, in Lagos, the COVID-19 pandemic will be affecting the celebration of Nigeria's 60th independence. According to the Commissioner for Home Affairs, the celebration will be held under strict compliance with the COVID-19 safety protocols. It says that while the coronavirus may have dampened the celebration mode, it's saying that the country had fought the virus and had success stories in spite of its ravaging across the world. He says we cannot roll out our drums due to the scourge of COVID-19 that is still with us. However, the Diamond Jubilee calls for sober reflection and thanksgiving for keeping the Nigerian state together thus far. We have more updates on the COVID-19 pandemic when we return. Please stay with us. Amidst the rising level of non-compliance, the Ekiti State COVID-19 Task Force wants residents to take responsibility in checking the spread of COVID-19. The coordinator of the task force, Professor Bolaji Aluko, says it will be risky for people to assume that COVID-19 has faded away or would fade away with time, insisting that prevention is golden. He observed that residents of the state in recent time have been downplaying the use of face masks, disregarding physical distancing and regular hand washing, among other prescribed protocols. He condemns the noticeable lapses, asking citizens to take responsibility. The head of the Africa Centers for Disease Control has praised African states for managing to curb the spread of COVID-19. Africa has seen about 1.4 million cases and 34,000 deaths since March. According to Dr. John Nkangasong, director of the center, he says early interventions played a crucial role in curbing the virus spread. He described as false suggestions that cases and deaths in Africa were significantly underreported. According to him, he says we may not have been picking up all the cases, just like other parts of the world, but we are not seeing people around the continent falling dead on the streets or mass burials going on. Here's more on the global update.
Have your new regulations gone far enough, Prime Minister?
The British Prime Minister has announced a massive package to protect jobs and indicated he will be looking at creative ways to do more. He says the government is also going to come forward with more measures, though he ruled out a simple extension of the existing furlough scheme.
Very difficult circumstances, and that's why we've put in the support that we have. That's why don't forget there's the job retention bonus at the end of the year to help people, to help firms to keep people.
In Spain, hospitals are under pressure from the number of people being admitted. More than 10,600 people are presently in hospital with COVID-19, 1,348 of them in intensive care. Coronavirus patients occupied nearly 10% of all hospital capacity across the country, but in hard-hit regions like Madrid, that share is as high as 25.5% as doctors complain of a lack of staff and resources. Passengers returning from France have been added to the list of those travelers who need to be tested for the coronavirus at Rome's Fiumicino airport. The rapid 30-minute test will now be compulsory for those traveling from Auvergne-Rhône-Alpes, Corsica, Hauts-de-France, Nouvelle-Aquitaine, Occitanie, Provence-Alpes-Côte d'Azur, and Île-de-France, the region that includes Paris. Belgium has decided to reduce the quarantine period for people with coronavirus symptoms from 14 days to 7. It's one of a number of new measures for the country, announced by the Belgian Prime Minister Sophie Wilms. The new quarantine rule will apply from October. The German Foreign Minister Heiko Maas is in quarantine after a member of his security team tested positive for the coronavirus. An initial test on Mr. Haas was negative for the virus, but the Foreign Ministry said in a statement today that would remain in isolation as a precaution.
Dr. David Ajibade is a public health physician and CEO of Brain and Body Foundation. He joins us from Virginia in the U.S. via Zoom. Thank you for joining us on the program.
Thanks for having me.
First, tell us briefly your experience leaving Nigeria from accessing the portal to the COVID-19 safety protocols as you made your way to the United States.
Well, I got to say I was quite impressed with the supervision and the adherence to the social distancing and all the other guidelines that are provided by the CDC. And I mean, the senior officials at the airport were there to ensure that every step and every guideline was well catered to up until we entered the airport and the plane, the airline itself. Also on the plane, I had about 3 stops because I was on the Ethiopian Airlines. They insisted that we had to have our masks, keep our masks on, except when we're eating. I'm not sure everybody followed that, but there was that attention to detail. Interestingly enough, when we got to the U.S., I came in through Washington, D.C. Obviously, the guidelines were attended to, but there was no question about whether or not there was going to be any quarantining or contact tracing or anything like that. It was basically just like before. All we did was wear masks. So I was a little surprised about that. I thought they would insist that we would be quarantined. And I've been in about 5 or 6 states now, and it's interesting how this attention to the directives are followed. It varies from state to state. So it's interesting.
Exactly, and that's also another thing. Just yesterday, the United States crossed the 200,000 death toll, sadly. From what you notice, is it that people are not complying, or is it the measures that state governors are putting are not sufficient to curb the spread?
It's both. Some are just not complying. Some state governors, some states are just not taking it seriously enough. I traveled with a friend who came in from South Carolina. We traveled to New Jersey, and she simply would not put on her mask. Even when we stopped to buy food or whatever it was, she would not. I mean, once they asked her to put on her mask, she would just walk out. She's like, she doesn't see why she should be enslaved. In fact, some people think it's a question of mind control by asking them to put their masks on. And I was at a retreat and with business leaders, very educated people, doctors, accountants, and all that, and none of them was putting on a mask. And this was like a 4 or 5 day thing. And I tried to put on my mask as much as possible, obviously. But again, in my case, because of what I know what to do, I'd use a lot of immune support and immune boosters to keep myself going. I don't know what they were doing, but it was clear that they didn't weren't concerned about it. And if you think about it, these are educated people. You don't know what the others who are not as educated or not as successful and enlightened as they would be doing. So it's still a problem. Like I said, it's very, very varied. Some governors aren't taking that seriously. Others are taking it extremely seriously, and the mayors as well.
Finally, I'm sure you're also monitoring what's happening, and that is the daily count that Nigeria is recording. I mean, the last 14 days, about 2,152 cases. But the Africa Center for Disease Control says that the continent is doing better, praising African leaders. What's your response to that?
Well, there's no question. I mean, when I compare the two, I mean, Nigeria, there seems to be a lot more seriousness about ensuring that this thing is kept under control. I understand that when you come back to Nigeria, there's still going to be a 14-day forced quarantine, and in some cases, they will not let you have your passport back until you have done another test to prove that you are actually COVID-19 free. And I dare say in other African countries too, they take it very, very seriously. Now, we do have some advantages, I have to say. Maybe some say because we have more exposure to sunlight, we have a younger population, maybe our diet is a little different, it makes us less susceptible to this. Some say because we've been exposed to chloroquine and viruses and bacteria all our lives, that we're more apt to fight against COVID-19. So it's a mixture of all those things. But for sure, governments, especially the Nigerian government, seem to be taking it very, very seriously.
All right. We'd like to thank you, Dr. David Ajibade. Thank you for joining us on the program. Wish you a safe trip back here.
Thanks very much.
Of course, that's the much we can take on the program. But don't forget, for further updates, you can take a look at our website. It's channelstv.com. You can find stories on COVID-19 updates from around the world. There's several other stories there as well at your fingertips, channelstv.com. Thank you for watching COVID-19 Updates. I'm Millicent Walker. Stay healthy.